Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
You know, Tracy, we have said multiple times on this program that when you go to your doctor, probably the two most important things that you want to take with you are a pencil and paper. And be sure that you write down your questions before you go to the doctor. And of course, it's always a good idea to take someone with you.
Absolutely.
Preferably a loved one or a friend, because sometimes you don't exactly hear what the doctor is telling you.
A
And you
second
can write,
set of ears is a good thing.
Oh, exactly. But how many times have you gone to the doctor and gotten home and said, "Oh, I forgot to ask my doctor that"? Huh? Everybody does that.
It
I'm
happens
sure
all
they
the
do.
time.
Yeah,
Even when we're
exactly.
here, it happens to me.
Well, you know what? Today we have family medicine specialist Dr. Elizabeth Cozine with us, and you and I, we've come up with a list of questions, of things that we may have forgotten to ask our doctor when we were there, or we suspect someone in our audience forgot to ask. So we're just going to fire these questions at you, Dr. Cozine, and you'll
Let's do
get
it.
Yeah.
You know,
And
one
have the first
advantage is now we have patient portal access, so people can look over their notes and see kind of what we talked about, and then send a message.
Yeah,
Here's
that
they
is,
do.
it's a great thing, isn't it? And, but you know what?
You need to
for-
officially introduce her. So here to introduce.
No, I did say.
did.
Okay, all right.
For older individuals, such as myself, I actually don't know how to use the patient portal. I should learn how to use it. It's not
Delegate the
that
loved
difficult,
one.
I
Yeah.
know. But
Yeah.
yeah, okay. All right, so yeah, you've solved part of the problem, but
I will tell you the first question that someone asked me recently when they find out what I do, they say, "Oh, find a doctor to ask them about ear infections."
Yeah.
Because they don't give out antibiotics for ear infections anymore. So let's start off talking about ear infections.
We used to just pass out amoxicillin like candy, but it kind of tastes like candy when you're little. But
And why don't we do that anymore?
well, you know, the problem is that we were treating too many things, and now what is typically what usually happens when a little kid has an ear infection, and first I'm going to talk about kids, then I'll talk about adults, is we know that the vast majority of what's called otitis media, which is infection of the middle ear, is caused by viral infections versus bacteria.
so the antibiotic didn't do any good anyway, plus the fact it led to a lot of resistant bugs out there. Because the
Exactly.
bacteria are pretty smart. Okay.
Right. And so now what we do is we use what's called a wait and see approach. And in most children, so thinking about kids roughly 2 and older, we recommend waiting 48 to 72 hours because the main problem that kids have is pain. And if we can treat the pain, which the antibiotic doesn't make a difference with the pain anyways, they can get through the infection without needing antibiotics.
So how do you treat ear infection pain?
Ibuprofen is a great way to treat pain, or Tylenol. We no longer use topical anesthetic drops, which were pretty popular even within the last 3 to 5 years, but now those have been removed from the market.
All right, what about HPV infections? I read the other day that half of American adults have an HPV infection below the waist.
Absolutely.
What is going on?
It's incredibly common, very, very common. And so HPV is a virus, human papilloma virus, that you might have heard of, which you clearly have. It's the virus that causes cervical cancer and genital warts, and it's also been shown in a lot of emerging data to cause a lot of head and neck cancers. So there are several different strains of HPV, which means types. The most common ones that cause cancers are 16, 18, and then some of the 30s. And so, you know, what we do when we're looking for HPV is do a pap smear, and that's where we just look at the cells of the cervix, which is the bottom part of the uterus, and then we do what's called an HPV co-test. And if we see that the cervix looks normal and there's no HPV, then we're really very reassured that the patient does not have exposure to HPV. But if we see normal cells and exposure to HPV, then we look at that a little bit in a different way and examine the cells a little bit more closely. If you see cellular changes plus HPV, then that is often handled in yet another different way, which is a colposcopy, which we look more directly at the cells. But getting off track here a little bit, there's a lot of HPV in the community. And so the way
it is sexually transmitted.
it is sexually transmitted, but not just genital to genital contact. So I make that very clear when I'm talking to teenagers and even adults, is you don't have to have sexual intercourse in order to be exposed to HPV. And so what I recommend is that teenagers and actually kids be immunized against HPV. The immunization is approved starting in age 9, and we know that kids mount a better immune response the younger they are when they get it. And just recently, we found out that kids mount a beautiful immune response if they have only 2 HPV immunizations. So in teenagers younger than 15, they can have 2 immunizations separated by 6 months rather than the traditional 3-shot series and have just as much protection against HPV.
It is, in effect, a cancer vaccine.
Absolutely.
Yeah, and the problem is you want to get the vaccine before you've had any sexual activity,
Right.
because once you get it, there's no treatment for it. Like the difference between true love and herpes. Herpes is forever.
You know, it's not quite that black and white because you can clear an HPV infection, but the best way to protect yourself is to get the immunization, use condoms.
So, but what about a male? I mean, you said that there was a test that you could do on the woman when you're doing the pap smear
Right.
to find it out. But how do you find out if the male has?
We don't test to see if a man has HPV just because of what you're saying, that about 50% of the population has, is shown to have been exposed to the virus. And so what we recommend doing is immunize those boys to protect their female partners. But like I said, this is not just genital contact, and it's not just penile vaginal contact that can cause these spread of infections. And so we want to protect boys and girls.
Yeah, but once the boys have it, the vaccine doesn't do any good, right?
No, not exactly. You would still want to get the vaccine even if you've had exposure to HPV
Oh, really? Oh, okay.
because it protects
Didn't
against the
realize
highest
that.
risk strain.
All right, what's next on your list?
Well, you're the one who wrote them all down, but I think we have
pot.
legalizing marijuana.
Yeah.
Because, all around the country, in Minnesota, I mean, just different versions of
Yeah.
the legalization levels of marijuana. And so as a physician, and as Dr. Shives pointed out, when you've got teenagers now that are going, oh, well, there's nothing wrong with marijuana, evidently. What is it that you're counseling patients about?
I always like to tell people that this is complicated. Like all things, there's not a clear answer about what is the right thing to do. And I think a good framework for this discussion is thinking about alcohol. There are people that have 1 or 2 drinks, don't have a problem with alcohol. And then there are people that are alcoholics and really can't have alcohol at all. And what we know about marijuana is that similarly, people can have troubles with addiction with marijuana. One of the problems with marijuana is that we don't have a lot of studies about it. So we don't have a lot of clear data about what is the actual addiction information and what are the long-term effects of marijuana use. But certainly I've seen patients who have health issues related to their marijuana use. I've actually encountered patients who've had positive effects from their marijuana use.
Oh,
So-
now what would that be? You mean like for pain control?
Well,
Or-
self-reported positive effects. How's that?
Yeah.
And
you mean I feel better when
I
I'm
feel better when
smoking
I'm
pot?
using
Yeah,
it.
okay.
There are some people that do things like treat their anxiety for with marijuana, which is not a approved indication for medical marijuana. And so I think when we're talking about the medical marijuana discussion, it's really important to say that medical marijuana is only approved for very specific indications. And those are those indications that we have some scientific data that shows that there might be some benefit.
All right, one more quick question, and that's about maternal pertussis vaccine. I didn't realize that women who are pregnant ought to get the whooping cough vaccine.
We now recommend the whooping cough vaccine, which is Tdap, which is tetanus, diphtheria, and pertussis, in every single pregnancy, even if you just had it in your pregnancy that was 2 years ago. And the reason for that is not only to protect yourself against the whooping cough, which is pertussis, but to protect the baby. So after about week 28 of gestation, we recommend that mothers get the immunization, and her antibody response will then protect her infant before that baby can get their own pertussis immunization.
It's not a shot that a baby can get.
Right.
Well, it's important to write your questions down. We did. Dr. Elizabeth Cozine answered them all. Thanks
Yeah,
so much
thank
for being
you.
with us.